Welcome to Women in Leadership Talk, where you'll hear from successful women who are empowering other women with their stories of adversity, resiliency, and success. And here is your host, Vicki Bradley, founder and CEO of Women in Leadership Empowered.
Hello, everyone, and welcome to the Women in Leadership Talk podcast. Thank you so much for chiming in today, taking us on your journey wherever you're going, whether you're walking the dog, you're in the car, commuting, maybe you're on your lunch break. We do appreciate that you take time and you listen to the great stories that we're bringing to the world. And before I jump into conversation today, please do hit that subscribe button. We want to make sure you get all these amazing conversations downloaded into whatever your favorite podcast platform is. So just take 2 seconds, hit subscribe, and then we'll just get right into the show. So I am thrilled today. I have Michelle Carnahan joining me. She's calling in from New York. So Michelle, thank you so much for taking time and being with us.
Vicki, as I was sharing with you before we hit record, I am absolutely thrilled to be here. I love what you're trying to do. We've talked a lot about lifting women up, lifting people up, and I think it's great what you're doing. So you have a really fun job.
Thank you. I do have a really fun job. I love it, but I love people. So for me, it brings me a lot of energy, fills my cup, right? And at the same time, I get to bring a lot of beautiful energy to the rest of the world. And, we're being listened to in 90 plus countries. And so to me, that's really exciting because that means we get to impact women all over the world. And so they get to learn about Michelle and what Michelle does. So let's jump into Michelle. So let me give a little bit of background on why we've asked Michelle to be here today. And then I'm going to jump more into questions so that she can fill in some of the blanks because I'm only going to hit high levels at first. So Michelle Carnahan's career has been defined by building and scaling healthcare organizations that drive better patient access and outcomes. She has over 25 years of experience spanning Fortune 500 pharma, digital health, and health tech innovation. She's led strategic transformations, launched global therapies, and driven billions in revenue growth with an unwavering focus on eliminating barriers to care. Thankfully. Thank you, Michelle. We need more of that because it's a hot topic.
It is.
She has also held senior executive roles at Eli Lilly, where she advanced from field sales to global executive leadership over 25 plus years across the U.S., Canada, Japan, and China. She then served as country chair across the entire Sanofi North American business, leading multiple therapeutic portfolios, including metabolic, immunology, and women's health. Women's health is such an important topic for us to get into today. And Michelle has all of these amazing accolades in her portfolio. So I'm going to let her tell a little bit about that. But she is the CEO and co-founder of Arbiter. And so let's jump in, Michelle, and let's talk about, more about who you are, what you do. You've built and scaled organizations across the pharma, digital health platforms, and now AI-driven infrastructures. So what was that moment that you realized that the system is fundamentally broken and that you wanted to be part of rebuilding it?
Absolutely. There wasn't a single moment. It was the pattern that I couldn't ignore. Across healthcare, you see incredible clinicians, committed payer teams, very motivated patients, yet care still breaks down because the system and the stakeholders are fragmented. One fact, Vicki, that always stands out to me is that nearly half of all patients who get a referral to a specialist don't go, can't get there. Not because they don't want care, but because the system unintentionally or intentionally, we can discuss that, blocks access through delays, handoff, administrative friction. And, that was something that I had seen over all these years. And it really became very personal for me when my brother-in-law began having GI symptoms and needed a colonoscopy. And the process stalled first when the system for a prior auth didn't get approved. And as COVID hit and backlogs grew, the delay stretched on. And nearly 2 years later, when the colonoscopy finally happened, he was diagnosed with stage 4 colon cancer.
Oh my goodness.
Now, I'm not saying that a different system would have changed that diagnosis, but what I am saying is that his care could have been better all
Mhm.
throughout his
Mhm.
treatment, which was incredibly complex. What followed was fragmented care across the multiple clinicians, the systems, the specialists. Nobody communicated well, and it slowed access when time mattered most to him.
Yeah.
And it really made me think about more about this access question
Mm.
and seeing this at scale in healthcare and then very personally made it clear to me that, I wanted to move my career in healthcare to be all about access. It's the
Mm.
problem I want to solve. And mainly, I always say healthcare should not add suffering to suffering.
Yeah, no
Like
kidding.
being a part of the system, you have a disease that is suffering enough. We shouldn't add suffering. And so it's that conviction that really led me to start talking with my co-founders Simka and Eric, and what is driving us as we build Arbiter.
Yeah. I love that. I love that. And grateful to you for wanting to solve the problem, because it is a system issue for sure. And, there's countless stories, and I'm sorry about your brother-in-law. Like, that's really hard. Knowing someone in your life is going through this, and had it been caught earlier, like, what would that have meant? Right.
It's funny. I tell these stories about healthcare, and my proudest moments in healthcare and my least proud moments are all because of a personal
Of course.
situation that I've seen in healthcare. And my brother-in-law passed away. It was just too late. And I think about, that doesn't happen once a day, twice a day, 100 times a day. If that happens tens and tens of thousands of
Yeah.
times a day to all kinds of people. And then I always tell my proudest moment in healthcare was I was working on a drug called Jardiance at Eli Lilly and Company, and we'd done a study. About half the folks thought the study was going to work, about half didn't think it was going to work, and it was reducing all-cause mortality in diabetes, particularly from heart conditions
Okay.
that come from diabetes. And the study worked. It had like a 33% relative risk reduction in all-cause mortality. It saved people.
Wow.
And what I tell about that story, which I think has karma or something to it, whatever you believe, divine intervention. We got the results of that study on my son's birthday. And my son was never able to meet his grandfather because his grandfather passed away from complications due to diabetes about a year before he was born. And at the end of the day, I always thought about, boy, am I lucky or what to work in a career? Because, you're giving back memories and moments to folks who might not otherwise get them if we get some of this right. And so, I always like to say that, the things that have driven me and woken me up the most in healthcare are where it personally touched me, which I think, is personal, but then I scale it in my mind and it's just so huge.
Wow. Well, first of all, that's beautiful how you've related the solve for the problem, and very heartfelt, because you've experienced things that have, really pushed you to find the solutions and have an impact. And it's a big machine. It's a huge machine. So having impact is quite tough.
It's a huge machine. It is. Although, I think I have a son who's 21, and he wants to save the world and win the world, all next week. And I think one of the things you have the benefit of as you get older is, I think in life, as you think about it, it's all the little incremental pieces. I mean, big change is incredible, but change really happens when committed people get together and all do their part. And so I think you said about this podcast, if like people take one thing away from this discussion we're going to have today, it's going to be fantastic. If I hope to change a lot more than one person's life, but if I can change one, it will all be worth it. And at Arbiter, we hope to change thousands.
Yes.
Millions, maybe.
Love it. Love it. Well, and it's such a need, right? And Arbiter is being described as that operating spine for healthcare. and what's been missing, right, in healthcare, like connecting all the dots. And, many of us have lived that, and really looking at, you saw these gaps that were in the system, and then how to take that and address it. And so what convinced you that it was finally the right time to start to build this new system to help navigate, where we are?
So it might be helpful to the listeners if I talk a little bit about the problem Arbiter's actually solving and how it's doing it. And then I'll talk about like how we got here. Right now in healthcare tech innovation, a lot of the solutions are point solutions. You've got a tool for scheduling, another for prior auth, another for care management. And I always love a good analogy. And what I say about that is it's like adding more instruments to an orchestra without hiring a conductor.
Arbiter, really well said.
We want to be the conductor. So operating spine, conductor, that connects really three important things: the record, the action, and then drives to alignment. So we have technology that unifies clinical, financial, policy data so that can all come together very clearly. It sets over the EMRs, over the workflows, and then we can take all that data and apply agentic AI to generate the next best action. And so one of the things that's so important about AI is it's only as good as the data you put into it.
100%.
And so we are putting that record together so that the action, the agentic AI, can actually come down and look in that data and figure out things like referrals, getting prior auths faster, getting scheduling to happen, follow-ups, without patients getting stuck between tool to tool to tool. And then once we get that action, because we call it this record action alignment model, once we get that action, we can create technology with key stakeholders. We think that's really important. So a lot of our programs are trying to put payers and providers thinking about the patient holistically, not in silos. So we can pull all that together and really align with the patient ecosystem technology that we have that can make sure patients get transparency in their information, get scheduling more quickly, get prior auths more quickly. So the goal of what we're doing is pretty simple: fewer delays, fewer drop-offs, and care that feels coordinated instead of chaotic. And, a lot of this is fixing a lot of those things I saw with my brother-in-law. But frankly, I saw through years of healthcare. It's kind of interesting because I spent the first 25 years of my career in big pharma, and I loved big pharma, and I got to work on therapeutics that, could change the world and certainly change people's lives. But I decided that I wanted to work on the access question. So I spent a lot of time there because all of those pills or, auto injectors, they're only hope in a bottle or hope in an auto injector until they get to a patient.
Right.
So I really wanted to take on this access question. And so you brought up women's health. I actually didn't do women's health at pharma. I did women's health at a startup company called 30 Madison. And what we were trying to do with 30 Madison in the United States was get the consumer more involved in their healthcare. And actually, we accepted insurance, but we also had reasonable cash pay levels so that you didn't have all that. And what I saw, which shocked me because, I'd worked in the traditional US healthcare system for 25 years, and some of the smartest people I've ever met work there. And there are amazing things happening there. Do not get me wrong. But what I suddenly saw when we took it closer to the consumer is adherence was better. More people refilled their medication. More people followed up and actually interacted with us in an asynchronous way. And I was like, how is this possible? Well, it was possible because some of the friction was taken out. And so at about that time when I was working at 30 Madison, I met Eric Moscow. And Eric is a longtime healthcare entrepreneur. And we both started talking about, and he really understands the back end system really well. I really understand the front end system really well. And we started talking about, boy, if you could find something to, now I like to say conduct, but to pull all of these things together. And we started talking about it some time ago, Then AI came along so quickly, agentic AI, which is really all about taking that data and moving to action. And so we kind of had a lot of conversations, and then early this year, put pen to paper, and I started working kind of in the first quarter of this year, and then really pulled the team and launched the company Arbiter in July
Love
of
it.
this year. But that's what we're doing and kind of how we got there.
Yeah, no, I love that. And thank you for explaining that. So it brought up more questions, Michelle, of course. So maybe back up just a little bit. So with Arbiter, who is the main holder of that information? Like, are we talking the GP is the person, general practitioner for everybody who's listening? Is that the person driving it? Is it more the patient that has to drive it? Like,
it's more the provider
okay.
is driving it. And some of this information sits in an EMR.
Okay.
Some of this information, though, sits with the payer who's paying for healthcare, right? Because particularly in the United States, what causes access to healthcare is who's paying for it, what is it going to cost, where am I covered, where am I not covered? And so one of the questions I get all the time, Vicki, that's a great question, is, well, who's your customer? Is it the patient? Is it the provider? Is it the payer? It's all of them. Okay. And, investors sometimes look at me and say, I like a little more focus than that. But let me tell you why it's important for all of them. Fragmentation isn't just about the technology. I say we're ending fragmentation in 3 ways. The first way is the technology, taking all those silos, becoming the conductor. The second is the data, and that's super important because it's not just clinical data you need when you're getting to action. You need financial data. You need to know what are the policies of your insurer. And so we want to bring tech together. We want to end fragmentation in data. And then we want to end fragmentation in the stakeholders. Okay. So we want to be sure that the providers and the payer, all of that data is with that patient. So when we're talking about action and alignment, and let's go back to the goals: fewer delays, fewer dropouts, and care that feels coordinated. You can't do that if you just go to the payer and say, I want to integrate with your workflows and actually drive this, because what we're finding in, our first kind of test case in market is site of care optimization. And what we're finding is there's payer data and provider data, when taken together, get the patient to a better action and get us to better alignment in their care. So I think it's really important that folks understand healthcare's fragmented everywhere. We started with how do we fix tech? How do we drive better data? And then how do we get stakeholders to work together for the patient, because they're working in silos right now.
Yeah. Well, and 100%. And you see that, and it's not intentional that they work in silos. It is because it's such a behemoth, right? I mean, it's massive healthcare. When you were saying that, where my head went, back in, early 2000s, I had my own health issues, and trying to navigate the system was a nightmare. Trying to get to the right specialist, to your point, it took me 18 months. And I mean, I'm in Canada, and I actually went on a wait list for Cleveland Clinic because I couldn't get care here. And so I was like, okay, I'm just going to have to go to the US and pay for this. And it was a lot of connections to get me into the right doctors, which ended up happening in Canada. But even from that, Michelle, it's like, I said to my GP, now I'm seeing all these doctors, but who's the nucleus? I need somebody to be the nucleus.
Right. There's not one. And, it's interesting, Vicki, because I often think about, I've spent almost 30 years in healthcare now, doing something in it. And, I have psoriasis and had been controlled on Humira forever. This is more than your listeners want to know, I'm sure. I've been controlled on Humira forever. And then, there became a biosimilar in the market. So they wanted to switch me to Skyrizi. Fine. But it took me over 5 months to get that prior auth and to get the care. I have great insurance. I know a lot about drug reimbursement.
Yes, you do.
25 years doing it. I'm a pretty good I can stick up for myself pretty well.
Mm-hmm.
And it took that for me. Guess what? I had a psoriasis flare, like everything that had been treated went away. And I thought, if I'm feeling that,
Yeah.
what do people feel who, are became a plumber for their living? I mean, I did this for a living, for goodness sake. So I'm not surprised you felt like you felt, because there needs to be a conductor and an operating spine, and that's what we're trying to deliver.
Yeah, I love that. I love that. And that makes it easier for the doctors, for the pharmacists, everybody, because then you have a clearer picture of what is happening and what's happening, customized almost to that individual, right?
Yeah, we get this question a lot with the AI component, is like, what is AI going to take away? AI in healthcare is really less about what it takes away and really what it can give back. And so if I have freed up a physician's time or a nurse's time, when I was going through this with Skyrizi, I was on the phone with the nurse. If I am freeing up their time to be with a patient who's having a healthcare crisis versus getting my paperwork finished, like, that's a good thing.
Oh, 100%.
So, to me, the great thing about AI in healthcare is not what it's going to take away, but where it can redirect clinicians back to clinical care, which I think is so exciting.
Yes, totally agree. I mean, like I've been spending more time with people in life sciences, and some of the innovation that's happening because of AI is incredible. Just like what you're talking about, the work you're doing at Arbiter, like, it is incredible, because you are speeding up the system so that people actually get the care that they need.
Yeah, and our goal is really, because right now we are speeding up the system. We're making it more inefficient.
Right.
We're making it more efficient. We're making it more efficient, and we are driving access. And we're doing it in a reactive way, though. You're going into your physician. These things are happening. We are beginning to build the technology to do it proactively. So somebody is over 55. They have a dad who had colon cancer and they've never had a colonoscopy. We are really building the system that can go in and look at a provider's records, pull those patients out, then contact those patients and get them there in a proactive way. And then ultimately, where we want to get to is, how are we predictive? So how are we finding that patient, like my brother-in-law, who's not 50 yet, who wouldn't have come up, but had a family risk and had GI complaints in the past? How are we getting it to, boy, this one we maybe should watch, and he should maybe have a colonoscopy earlier. Let's reach out and get that done. And once we start getting predictive, the impact financially will be huge.
Yeah. Well, and even when you were just saying that, like, where my head went was, not everybody needs to have it. So you get to the people who actually do and who have the higher risk. And so that in itself really has an impact on the system.
That is, I think that's one of the things in the US right now that our data is telling us a lot. So we have a lot of data. We can see a lot of trends in healthcare.
Right.
And as we look at the data, one of the things it's telling us on the way some folks are coded, interesting thing, just on how you're coded, that there's oncology money, so money to treat oncology, going to patients who have maybe had their oncology treated. And the issue with that is, what if I'm a newly diagnosed patient with cancer? Like that, it limits money in the system to get to me. And so that's exactly where your head should go, Vicki.
Okay. Wow. So you're doing some crazy good work. This is awesome. And, one of the things that comes up when you're talking about that is the importance of trust, right? And then there's all these power dynamics that often will get in the way. Like when you think about who's leading who, and, is it driven by the doctors? Is it driven by pharma? Like whoever, right? Like there's definitely power dynamics going on. Yeah. So how have you and Eric learned to build trust inside the systems that have historically been fragmented or maybe political or resistant
Yeah.
to change.
So a couple of things. I mean, I'll kind of start you with, because, I worked for pharma for a lot of years and we had some trust issues.
Mhm.
And I think, to me, as I look at healthcare and as I think about family members who've had health challenges, and as I've really looked at the system, I think people need three things in healthcare to feel trust. The first is competent clarity. The second is equity. And the third is follow through. And so those have always kind of been my North Star, whether it was at pharma, whether it was at my other health tech startup, or whether it's at Arbiter. How am I bringing more competent clarity, more equity, and more follow through to the system? And that's another thing that is really kind of Arbiter's sweet spot. The thing about fragmented systems and opaque system is they become political because accountability between stakeholders and the patient is blurry, right?
Mhm.
And when no one can see what's happening, people fill the gaps with assumptions, workaround, or power plays. So we want to approach trust by making the work visible and the outcome shared. When everyone can see what happened, can see why it happened, and what comes next, power dynamics can soften. So transparency replaces opinion, clarity replaces opaqueness. And a really important thing about our alignment with Arbiter is we've got to measure that, because we've got to measure it and understand it and get to the facts, not different versions of the truth. Hence our name, Arbiter.
Love that.
Not different not different opinions, but what are the facts, and how do we arbitrate to those facts so that everyone knows them in a transparent way that can deliver that to patients.
Yeah, love that. Love that. And I think patients are asking for that, right? Doctors are asking for that. Everybody's asking for that. Like
Right.
your mission, your vision is, it's actually catering to many needs and many wants. Like they want the version of the truth and as many facts as possible to substantiate. So I love that you're doing that.
I don't think many people, whether they're a provider or a payer or a pharma person or an entrepreneur like myself, I don't think many people go into healthcare without some understanding of the real importance you play in people's lives. I used to have a boss who used to say, I used to love this expression, we're not selling Hershey bars. Not that there's anything wrong with selling Hershey bars, but it's different when you're selling healthcare to folks. And I think people want to do the right thing. Not everyone. There are bad apples in every group, without question. But how can we give tools that allow the right things to happen?
Yeah. Yeah. Very true. Very true. So, Michelle, I'm going to shift gears just a little bit because, like, you clearly are a rock star woman doing incredible work and in pretty heavily male-dominated industry. So I'd love to hear from you how you've navigated, right? Like, you're scaling, you're global, strong beliefs, strong power systems. How, as a woman who traditionally were underrepresented in these organizations, how have you navigated that and, come out doing so well?
Yeah. I have two things, I think, right, because I get this question a lot. First of all, I always believe strongly in bringing my full self to work. Look, healthcare is hard. Jobs are hard. The problems are complex. The stakes are high. And there's no time to spend energy on being someone you're not.
Yeah.
Authenticity is not about oversharing. It's about being grounded. It's about being clear in how you show up. And look, not everybody's always going to like it. And I think sometimes that's hard for women. I think sometimes we want folks to like us. I'm not saying here that you should go out of your way to be unlikable by any stretch of the imagination. But I am saying, be who you are and take that full self to work. And if it doesn't work there, you can find someplace else to work. But it takes so much energy to be someone you're not. And look, there are times like do not get me wrong. Like I have like I've had bosses that have had too much Michelle Carnahan. So it's not, but authenticity is important to me, and being yourself is important to me. I think it helps you be a better leader, but more importantly, it just helps you do a better job. And then the second one, I would say that I would particularly stress with women just starting out in your career is influence becomes a skill you can't practice. It's not a personality trait. It's not the loudest person. It's not I was born with it or I wasn't. Don't wait to be invited into authority. Be explicit about the outcomes you drive. Ask for the scope you want. What I've learned is that influence doesn't come from talking more. For me, and I like to talk a lot, for me, it comes from clarity. When you're in a room, try not to over-explain. Say your point clearly, and once you land it, clarity builds credibility. Credibility creates room for leadership. And the final thing I would say about influence is I don't think you can be an influencer if you don't listen. And this is where I don't agree it's always the person who talks the most. I always don't agree it's the person with the most executive presence. You have to listen. But then the advice I would give on being a listener and having influence is once you listen, once you take it all in, decide and then act, because it goes back to that clarity piece that people want. So I would say authenticity and influence are the two things that I think are really the thing. If I could go back to my 21-year-old self and say, learn these two things, it would be those things.
Beautiful. I love that. So funny you said that, because I was in a group session a few minutes ago, and we were talking about the authenticity and the importance of showing up fully, because eventually you're going to. So why not just always come in being yourself? Right.
Yeah, I have a story that because I love stories, and people always tell really good ones. I'll tell one that's not so good. I was promoted to VP in pharma, and my second boss in this particular job was like, you overshare, you talk too much, you're too informal, I was really all these things that he wasn't. Mm-hmm. And so I changed. I tried to be him. I became sterner. I became more serious. I didn't mention what my son had done the night before because it might not be deemed That wasn't me. I had my worst results that year. That year I didn't make plan. People didn't like working for me. Not that, Michelle Carnahan can't overshare and doesn't, not that I don't have when I'm bringing my full self, not that there aren't things to improve on, because they are. But when I tried to be somebody different, because of clarity and coaching, I mean, my boss was clear in what he wanted. It just didn't work for me. And it made my life worse, but it made like my business results work. And so, I've not always done this perfectly. I wish I would have done it better from time to time.
But that's a great share, Michelle. And thank you for saying that, because it also clearly impacted your team, right? They didn't like that you weren't showing up authentic and vulnerable or oversharing, because they were connecting with you as a person.
And people know, people can tell if you're people are smart. Come on.
Exactly. And you want to do work and business with people you know, like, and trust. And if you're showing up as something you're not, then people are questioning that. So you're 100% right.
The other thing I'll say, by the way, on this, the boss who actually was like that with me ended up doing incredibly well. So the thing that teaches me is because that was him, right?
Yes.
And so you don't have to be one way. And I think that's important.
Yeah. Love that. Yes. You be you. Let him be him.
That's right.
Love it. So I am cognizant of our time, but just one or two more questions. So when you imagine healthcare 10 years from now, what do you hope will happen? What do you want to see? And when you think about what stresses you at night or keeps you awake, I don't know about you, but I do that 3:30 a.m. wake up where my head starts going.
Yeah.
What does it look like for you?
Well, so my 3:30 wake ups are usually, I mean, I have a 22-year-old son now. And at the end of the day, I still am usually waking up about something at him. Is he happy at work? Is his apartment clean? Is he going to catch a disease in that bathroom? So that's usually it. And then I usually take on the meatier topics like healthcare. Look, what gives me hope around healthcare are kind of two things. One, I think we've got some really unique tools to fix this. Data connectivity, AI, and leaders, frankly, who I've worked with for years, leaders in the payer space and the provider space and the pharma space, leaders who are becoming no longer willing to put up with the status quo. And that's important. And those things make me really excited. And if we do these things right, I got to ask a question, because we've launched Arbiter, and so I've done a couple of podcasts, and I got asked a question a few weeks ago, like, what's your dream for healthcare technology? And it was a tough question. I hadn't thought about it that much, and I said, that healthcare, that my healthcare, that Arbiter can become as good as Netflix, because I do one thing on Friday night, and that is go home, sit on my couch, and watch TV. I do a little needle pointing sometimes if I have a lot of extra energy. And, like Netflix can always take me to like, this is what you'll want to watch, Michelle. Like that is just data connectivity, AI, and knowing it's record action alignment, right? It knows my record. It knows what it watched. It knows what to tell me how to watch it. And it knows how to bring that up again. That's what I hope. What keeps me up at night is trust. Because I do think a lot of people feel like they've been wronged by the US healthcare system. And if we don't find a way to build these systems transparently and responsibly, we miss losing the opportunity of those things I just listed. Yeah. And that's why we at Arbiter are focused so much on human in the loop design, measurable outcomes, and that alignment across stakeholders, like really getting to the root cause of the system versus I'll make this record over here. I'll make this instrument a little bit better. How do we conduct? Because, I think my dream is healthcare, our healthcare system should not add suffering to suffering. Yeah. If we can make the system work as one, even incrementally, as we talked about earlier, just a little change, the impact's enormous.
Yeah, it's huge steps. Yeah. Wow, Michelle, thank you. Thank you for all the work you're doing. And, just to wrap up, what would be one thing that you would want to share with our audience that you really hope they walk away with today?
So, I think as of everything that we've talked about today, I hope that folks walk away with the belief that even one small thing can change things. I do think, listen, like I said, I hope Arbiter has millions and millions of patients. But sometimes when you get your head on the millions and millions, you forget the one. You forget that one grandfather that lives long enough to see his grandson born. Yeah. And that's the stuff that really matters. So, Vicki, I want to thank you for doing these podcasts and for inviting me on. It's been so much fun, and the time's flown by.
It flies. And Michelle, thank you. Thank you for saying that. And I love doing it. I love bringing incredible voices, and you certainly are high impact and doing some incredible work. So we thank you for all that you're doing, and you've got great energy, which I love.
Somebody, you caught me on a good day. My Aura ring says I got 7 hours last night. So
Perfect. I'm saying got you on a good day. It's awesome. No, seriously. And from, genuineness, I am so grateful to you for sharing with us the work you're doing. And, audience, you're hearing this first time. So share this. If you have people in your network that need to hear this message today, please do take time, share this message with them so they can learn about what Arbiter's doing, what Michelle and Eric are doing. Just really grateful for the innovation and the, heart purpose driven focus that both of you have clearly.
Well, and we have a third co-founder. So Simca Hyman is also along for this journey and has been incredibly instrumental in really understanding a lot in geriatric healthcare and where that is going. So I think we're incredibly different people, which is challenging sometimes, but so much fun.
Oh yeah. Well, it takes a village, right?
It does.
It takes a village. Awesome. Michelle, thank you so much for being here today. And audience, I want to thank you for being here. We know you have a choice to what podcast you listen to. So we want you to continue taking us on your dog walks or your car rides, or, you're having a bath and just relaxing from a crazy day. Take us with you. Tell us what you're learning. Tell us what you got from the conversation today. We'd love to hear it. And as our gift to you, as always, if you visit us at Women in Leadership Empowered, we have a 2 mini series that you can tap into, which is all about habits and fear, which is awesome. So how to use fear to propel yourself, and instead of making you run. So check us out on WIL Empowered. That's 1L, and we'll see you on the next Women in Leadership Talk podcast. Take care, everyone. Thank you.
Bye, Vicki.
Thank you for joining us for WIL Talk, sponsored by Women in Leadership Empowered. To learn more about our programs, please visit www.willempowered.com. We look forward to seeing you in our community.